Afternoon. Today is a beautiful day and an exciting day. My name is Jim Olatris. I'm the president of the Rockefeller Institute of Government, and we are excited to be finalizing the first year of the Center for Law and Policy Solutions intern class, who you are joined here with today. And I'm really proud of the work that Hannah, Maria, Prejeanette, Jillian, and Joelle have done. And we're going to hear from them in a minute. And I'm going to turn over to Dr. Katie Zuber, who is running the program soon. But when we first started this program to put research into communities and really try to get at problems in our communities, we focused right away on the opioids crisis, and it's something that we've been focusing on. Dr. Strzok is here, who's been working with Katie in Sullivan County. And these students have spent months digging into the effectiveness of drug courts. And what's important of this, they have come up with some really interesting findings, which will be put in a report and submitted to the legislature next week. So their research and their analysis is actually going to the hands of policymakers to make sure that those things, their voices are heard. And I think they should be proud of themselves, because you don't often get a chance in life to work on something that can affect someone's life in a positive and meaningful way. And what they are doing here, and what they did here for the last several months under Katie's leadership and guidance, could actually help save lives. And for that, I just like to give them a round of applause before they start. And no pressure, right? Just here's an issue, you have to affect people's lives. But anyway, I'm going to turn over to Dr. Katie Zuber to kick off the event. Dr. Zuber.
Thank you for that, Jim. I just wanted to start off by saying a little bit about the Center for Law and Policy Solutions, what our mission is, and how that ties into the broader internship program. As Jim suggested, one of the things we really try to do is to study local problems in local communities so that we can assist policymakers and the general public and people in their communities in developing solutions to pressing public policy issues. So that is one of the reasons why you are going to hear the interns talk today about the effectiveness of drug treatment courts, particularly in the capital region, as a response to the ongoing opioid crisis. This internship is critical to our mission at the center in several ways. So we see this not just as an example of our commitment to good governance and informed decision-making, but meaningful experiential education for our students. So one of the things we try to do is try to equip our students with the skills that they will need to succeed outside of academia, particularly in the world of work, but there's so much more to that, right? So we don't want to just set up our students to go out and to get a job. We want to give tomorrow's leaders a really firm grounding in the use of research and data in the policymaking process, and to ensure that their knowledge can help policymakers make sound public policy decisions. So we have selected these 5 bright students, Prejeanette, Maria, Hannah, Joelle, and Gillian, to help us accomplish that goal. One of the things I want to actually point out to you about our interns is that many of them are still early in their academic careers. So they are just preparing to finish their sophomore year at the University at Albany, and that wasn't by accident. Most internships at the University at Albany and other institutions of higher learning are generally reserved for upperclassmen. And so part of our mission was to create a new internship opportunity for younger students who are typically denied those opportunities. So we've chartered this course based on the knowledge and understanding that an internship experience early on in your academic career can improve retention rates and strengthen the overall academic success. And generally improve the quality of higher education. So we will continue to study issues. We, of course, will miss these interns when they go, but we will continue to study local issues in local communities. But again, this particular group has taken the topic of drug diversion courts under study. And at a time when the opioid epidemic threatens to overwhelm and disrupt every aspect of our judicial system, the study of these so-called problem-solving courts in New York couldn't be more timely. So I will hand it over to them.
Thank you, Katie. First of all, we would like to thank all of you for coming to our presentation on drug diversion courts. First, we would like to start with why drug courts. Drug courts have been widely embraced as a solution for people struggling with substance abuse in the criminal justice system, especially now due to this opioid epidemic. And just last year, 64,000 people have died due to opioids. Both parties in Congress and even the president and all of that they have agreed that this has been a growing problem in the United States. And because of this, we would like to know to what extent have these drug courts been meeting the needs of their participants, and can they effectively respond to the opioid crisis?
So the way in which we gathered our research consisted of a request for statistical data from drug court, which included the number of referrals that they received, the number of participants that they admit, the general profile of these participants, their drug of choice, and the graduation, recidivism, and retention rates. Ultimately, our request for data was denied by the Office of Policy and Planning, and because of that, we had to rely on extensive background research and semi-structured interviews from individuals such as Ulster County Resource Coordinator, Narcan trainers, and peer engagement specialists.
As we concluded our research, we have found that to effectively combat opioid, policymakers must invest in education, prevention, and actual treatment for those struggling with substance abuse. To understand why drug courts were established and need to change, we must understand that although these courts were the right step for a solution, the stigma and understanding of drug abuse hasn't changed, or it is currently changing. But the reason why they were instituted in the first place were because of the proliferation of incarceration. In the 1970s, President Nixon declared drugs the public's #1 enemy, and so increased funding for federal drug control agencies and proposed mandatory prison sentences for drug crimes. The consequent presidents expanded these drug war policies, like with Reagan signing the Sentencing Reform Act and Clinton enforcing the 100-to-1 crack versus powder cocaine disparities, and thus causing prison population to skyrocket.
So, in 1973, the Rockefeller drug laws were passed in New York, which imposed draconian penalties for drug crimes, whether they were major drug crimes or even very small possession crimes. So since the 1970s, the rates of incarceration have increased rapidly because of these laws and other harsh policies from the war on drugs. But the prison populations in New York have been starting to decline, and that could be due to a number of reasons, such as diversions like drug courts, and also New York has been repealing mandatory minimums, and Obama's Fair Sentencing Act of 2010 got rid of the disparity of the 100-to-1 crack cocaine policies.
For eligibility, generally, drug courts do not accept violent offenses, but certain counties do make exceptions. For example, in Sullivan County, they do not accept people who have a burglary offense because it is considered a violent offense. But in Ulster County, they make an exception, and they do accept people with that offense. And according to the drug court coordinator from Ulster County, they are usually the most successful cases that they for accepting those them.
So treatment for participants in the drug court are decided by the drug court team, which consists of the judge, resource coordinator, district attorney, and treatment providers. And so those treatment plans are on an individual basis, but all participants follow a basic 3-phase program, which the first phase begins with weekly reporting and the beginning of treatment. And then after that phase, the following phases taper off the instance of reporting to ensure that the participants are able to self-sufficiently manage their own substance issue on their own upon program completion. Medically assisted treatment is also very important for the courts. It's a way of withdrawing from drugs like opiates, and the most common medically assisted treatment drugs that are used are methadone, buprenorphine, Suboxone, and more recently, Vivitrol. It's been illegal in New York since 2015 to deny MAT patients from entering the drug treatment courts, which a lot of judges were apt to do because they thought that medically assisted treatment is just substituting one drug from another, so they would ignore the medical benefits, and they still, although they can no longer deny people who are already using medically assisted treatment, they may not be pushing for it like they should. Again, the primary reason for the proliferation of drug courts was to reduce prison populations, but I'm sorry.
In order for participants to graduate from the drug courts, each participant must have had completed each of the treatment phases, as previously mentioned by Hannah. They must have abstained from using drugs during their treatment process, which also raises the problem of recidivism during treatment. And they must have had their graduation application approved by the drug court team. Some drug courts may additionally require their participants to attend community service and exhibit progress towards their vocational and educational training goals. Nationally, only 50% of participants actually graduate from these courts, and that percentage is unknown within the 3rd Judicial District, mainly because our request for data was denied by the drug court statewide coordinator.
Okay, so a main reason for the proliferation of drug courts was for reducing prison populations, but how effective are they actually in doing that? In a study of New York drug courts, it was found that there's a 32% reduction in recidivism for graduates after 1 year. And you could see in following years, there's a small but obvious decline in effectiveness. This number, though, is only true for drug court graduates, and as Joelle said, only half of the participants of drug courts actually complete the program. Participants who fail the program may end up serving a sentence much longer than they would have if they were not diverted to the program. This is partly because of sanctions of jail time. Oh yeah, you could switch slide. Sanctions of jail time that happen during their program, and also because most drug courts utilize a post-plea model, so that you have to plead guilty in order to enter the drug court, which means if you fail the drug court, you also lose the option to try to reduce your sentence, and you're stuck with a full sentence. Drug treatment courts are also more effective when they serve participants who have a high risk of reoffending and a high need for treatment. They reduce crime twice as much as courts that serve lower level offenders. The high level of supervision and random drug tests are more effective for people with more serious addictions or who have been resistant to treatment in the past, whereas a program of this rigidity can be overwhelming and counteractive to the success of people with lower need for treatment. People are also worried about a net widening of the carceral system through this, meaning that they think if police officers believe that the people they arrest will be diverted to treatment, then they may start arresting more people, even though the courts and the treatment providers don't currently have the capacity to take all of those people.
There are some challenges that the participants face when they're in the drug treatment programs. People who are participating are required to not only pay for the services, but because they also need to do so in order to successfully graduate. For example, participants have to pay for child care services, drug testing, counseling, therapy, and many more. Participants are generally required to pay for drug tests depending on the county and the state. Drug tests tend to cost around $10 to $30 each drug test. Because participants are required to take drug tests twice a week, it can be burdensome for a person who is financially unstable or for a person who has a family. That would mean that a participant would have to pay up to $120 a month, aside from the fact that they also have to pay for the drug court fees. Transportation can also be burdensome for a patient who does not own a car or public transportation does not provide service to the area where the person is living in. This can be an issue because drug courts tend to place a ton of meetings for the patient to attend and drug tests to take. Or sometimes the drug courts are very far away, that causes issues. This is where the child service fee would have to be relevant for a person. For example, like a mother or a father who do not have a babysitter or a family member to rely on when it comes to having the children being supervised. Public transportation can be expensive, where it can be an issue if the patient, like I said before, it is financially unstable. For example, in Greene County, the public transportation fee costs $3 for one fare, while in the state in New York City, it's $2.75. Since drug courts tend to schedule a lot of meetings and drug tests to administer, this can be a money issue. According to Data USA census on Greene County, 1.2% of the household population take public transportation, while 2.9% prefer to walk to work. Based on the statistic, one can assume that the reason why the percentage of people walking to work is much more higher than taking public transportation is because in Greene County, public transportation is very expensive.
So in regard to access, one of the things that we've also run into are institutional barriers such as cost cuts. So behind me you can see a quote from a resource coordinator describing that mental health care services are not available to people if it's not covered by Medicaid or if they can't afford private treatment. What they have is called the dual diagnosis. So in addition to being afflicted with substance abuse, they may also have a mental health issue such as depression or post-traumatic stress disorder, bipolar disorder, what have you. And so what we see is that they're sort of left vulnerable to these mental health issues impacting their sobriety without sufficient support. The next slide, please. So another issue is housing. So in Sullivan and Columbia counties, there is no inpatient services whatsoever. Not even Columbia County Hospital offers any kind of a drug treatment avenue. And a really good kind of microcosm of this problem can be seen in Greene County in TCRS, or Twin County Recovery Services. It's an inpatient program that has 431 patients, but they only have 12 beds available for women and 13 for men. And they were granted permission by the state to expand this residency to 18 beds. However, funding wasn't allocated as well. So this permission to expand their residency is essentially rendered moot by the fact that they don't actually have the money to expand their residency in the first place. You can go ahead.
So another major challenge of the treatment process is the social stigma faced by these individuals struggling with substance abuse. So stigma presents two major issues. One, it prevents people from coming forward and seeking help. And two, it prevents the innovation of new treatments and services, such as medication-assisted treatment, clean needle exchanges, and safe injection sites. Sorry. These individuals have to endure social disapproval, and they're constantly scolded by their communities. People like public figures, law enforcement, and sometimes even their own friends and families. These individuals are constantly dehumanized. They're usually perceived as criminals who have to be punished, but in reality, these people are just like us, and they have a problem, and they need guidance and courage to come forward and seek help. Sorry.
As we conclude our research, we've come up with policy recommendations that should be taken into consideration before drug courts are seen as a solution to substance abuse. As our key finding dictates, we must increase funding in education, treatment, and prevention. We have conducted an interview with former president of Pathways to Recovery, Carl Quinn, and he informed us that because of the lack of treatment in Columbia County, people have to seek it elsewhere. For example, they must go to St. Mary's Hospital, Benedict Hospital, and I think another hospital in the Troy area. So he suggested that there must be an addition to both outpatient and inpatient treatment. And one example of outpatient treatment is ambulatory detox, which is where patients go see a doctor, a nurse, and a counselor to seek medication for a period of various days. And that way, they won't be able to leave the county or where they live and are able to keep their support system, such as their families and friends, with them. And there is a need for inpatient treatment for those who need long treatment, up to 6 to 9 months. And that way they also don't have to go somewhere so far, which actually discourages them to seek treatment.
Another policy recommendation that we have is the inclusion of case management and what we call wraparound services. Now, wraparound services would include things like educational, vocational training upon release so that they're able to find employment and support themselves and obviously, hopefully not fall back into the same habits. And as far as case management goes, it's important to realize that not even the drug courts themselves in some cases have the money to have their own case management services, let alone have case management for their drug court participants.
Other policy recommendations we have are to increase funding for public education as well as to increase funding for peer recovery services. The Capital District currently only employs one peer engagement specialist, and his role is to assist those struggling with substance abuse in guiding them and navigating treatment options most suitable for them. He's currently based in Rensselaer County. However, he has to travel across various counties in order to provide assistance to those who seek his guidance. The position is very helpful, and it's too much for one man alone considering the volume of people that call him for his help. So yeah, they need way more funding considering that it's only grant funded. Another suggestion that the peer engagement specialist has is that there are a variety of treatment and services available, but people don't really know about them and they don't really know how to find them. So there needs to be more funding for public education so these people can actually seek out these services and treatment options that are suitable for them.
In addition to this, drug courts, while they do demonstrate moderate success, are limited in the range of people that they could reach. And if the goal of drug courts are to reduce the overpopulation of drug users in prison and to help with substance abuse, there are preventative measures that could definitely be taken that help. In particular, principles of harm reduction are very helpful for dealing with substance abuse issues. And a principle of harm reduction is to meet users where they are at their current situation and offer them the help that they are willing to receive at the time. So that can mean things like syringe exchanges, which reduces the incidence of HIV and hepatitis B, safe consumption spaces in which the risk of overdose is virtually zero. And it also offers a space for people to use drugs out of the public eye, seeing as drug use is often considered a public nuisance. The promotion of harm reduction principles can also build trust between users and care providers and make them more willing to seek treatment, especially because a lot of them fear being arrested or charged with anything for their drug use. A tool that can help to reduce incarceration of substance abusers is diversion by law enforcement. Law enforcement and drug users have had a rocky and distrustful relationship for years, but that's beginning to be mended by programs like Chatham Cares for You in Columbia County and law enforcement assisted diversion in Albany, which utilize the police force to divert drug users to treatment before they enter the criminal justice system. LEAD in particular, which started in Seattle, has been successful across the country and has seen a lot of growth. Their method is pre-arrest diversion. So all Albany police officers have gone through 8 hours of harm reduction training and how to identify people who are eligible for diversion. If someone is eligible for diversion, they're quickly matched with a case manager who helps them find housing, employment, treatment, or whatever other services they need at that time to help them out of their situation. Law enforcement assisted diversion boasts a 58% one-year recidivism reduction, which is larger than drug courts. And drug courts in Seattle actually work collaboratively with LEAD, so they can refer drug court participants to the LEAD program if they find that the drug court does not have the proper level of care and isn't a good fit for the participant.
Additionally, we recommend that the drug courts should be more transparent in order for researchers and specialists to be able to really unpack the data and conduct more innovative research. Well, we found this really challenging for us as well, because a lot of the data that we needed that would have been very useful to us in conducting our own research was out of our reach, considering the fact that these drug courts, that the statewide coordinator went out of his way to deny us access to this kind of data.
So most recently at the federal level, we've seen President Trump propose expanding federal treatment courts. Now, this applies to both the federal and the state, but essentially our proposition is that expansions to these courts without proportional expansions to funding essentially creates a revolving door where people are not receiving adequate treatment, and obviously more people are suffering overdose deaths. And a more extreme example as well that we've seen from the Trump administration as of late is the proposition to begin the death penalty for people who are found to have trafficked opiates. This is abhorrent in many ways, and the rest of our research dictates that these kind of punitive measures, especially up to and including the death penalty, are going to have a completely inverse effect on the well-being of the general health of the American public.
So thank you guys very much. You did an excellent job. Pressure is not off yet, however, because we do have some time to take any questions from our audience. I don't know, do we have a mic for questions? Okay, Michelle has a mic, so if you have any questions, please feel free. You can ask them about their research, but also feel free to ask them anything about their internship experience overall. And Michelle will bring you the mic.
Great presentation, guys. Very impressed.
Thank you.
Just kind of, you mentioned briefly about being denied all this data. Did they cite why they denied your request? Or do you have an idea of why they didn't let you look at it?
You want to? Okay.
So essentially, they weren't able to determine how our study would portray them. So mostly based upon that, they decided not to share data, but it was more so that they had emailed additional offices and personnel and instructed them not to communicate with us as well. So it wasn't just this one office not communicating or sharing data that was crucial to the research, but sort of getting other people to do that as well.
Well, you seem to come to some good conclusions regardless, so thank you.
Well, we also have a FOIL request pending, so we'll see how that goes. Maybe it'll be accepted and we'll get more data. So.
Thank you very much. Nice job. I was wondering if you could tell us a little bit more about the staffing of the drug courts, the typical staffing. What kind of people that they have and how many individuals they have to sort of handle the cases. And also a little bit more about the judges, their backgrounds. Are they purely legal backgrounds, or do they have any training or background in mental health or drug addiction, or are they provided certain kinds of training? Thanks.
So the judges are really just your basic typical judges. They are supposed to receive a lot of trainings, but after the fiscal crisis and the recession, a lot of funding for drug courts stopped, so a lot of these trainings also stopped. So judges are pretty involved with the medical decisions and like all of the decisions of participants in the court, even though they are now currently lacking a lot of the trainings and like updating their own knowledge to deal with these problems. But the drug court team, yeah, it's like there's like a treatment provider, the judge, public defender, DA, resource coordinator. So a group probably of like 10 people. They're supposed to have weekly meetings to go over the current state of the program and where the current participants are at.
Just one thing I wanted to add with respect to understaffing was a resource coordinator that I had interviewed is not only the resource coordinator for drug courts in New York County, she's also the domestic violence court resource coordinator. And she herself, again, does not have a case manager. So that's obviously a lot of work for one person, but especially in the realm of drug treatment. Understaffing is something that we've run into repeatedly, not just in the courts, but at inpatient facilities as well. The one I'd spoken about earlier, the Twin County Recovery Services, conducted an internal review of itself, and literally the first thing in the report is them citing that we do not have enough staff, in addition to lack of beds and things like that.
I have two two questions for you. The first one is, if you were to do this project all over again, if you were to rewind, what would you do differently? And the second question is, what did you learn from this experience? Maybe something you weren't expecting, or something that you learned that you're going to take away with you.
Something that we would have done differently, I guess something that stopped us completely was the fact that we weren't allowed all this data to come to us, so we weren't able to effectively kind of see the we weren't able to effectively see how are these drug courts kind of constructed, and we weren't able to talk to the participants either, or people who actually work there. So I guess writing a lot of the literature we've read would have actually helped as much as we could. Interviewing people, not just the research coordinator and people who work there, but for example, I've conducted an interview with Katie, and we met with this, we talked to Carl Quinn, and he is from Pathway to Recoveries, which is an organization that was started by simply mothers who saw what the opioid crisis was happening, and they're like, we need to do something about it. So talking to people was something that if we had more time, we would have talked to so many people that are actually affected by this. Writing, once again, is something that I'm gonna take away from this, because I feel like we had to write a lot to comprehend the data and articulate better and stuff like that.
Yeah, I just want to add that at first we were really relying on the data from the drug courts to come and help us on our program description and such. But once we wasted a lot of time waiting for that data to come, and once we realized that we weren't gonna get it, we started really working to talk to as many people as we could. And that's when we realized that these people, our interviewees, they have a wealth of knowledge on this matter. And if we only had more time to continue interviewing and continue reaching out, we would probably have a lot more to say and know.
I had just one last thing to add there. As far as things I would take away from the experience, I mean, not to keep harping on the transparency thing, but I certainly had expected the state to be a little more forthcoming and helpful as far as our research went. And in the context of the opiate crisis, the decision to not share that data struck me as, I don't know if callous is really the correct word, but perhaps not as responsible with respect to people who are looking into things which very much impact public health.
Do you think you have any avenue to make your results available to other communities? A friend of mine is a drug court judge in another state, and I think that the information that you have gathered could be informative and perhaps channeled to a different legislature as well as your own. And I wondered if you had any plans or any way to make your findings available.
We are publishing a report, I think, this Monday, and it will be available, I think, in the Rockefeller Institute website. So it will be available for other politicians, policymakers, the public to be able to read and see what we've come up with. Yes.
Jim.
Well, first of all, thank you very much. You guys, it's impressive to see a young group of students really get thrown into a research project. And Katie really deserves a lot of credit, but you really did a real research project that the Institute, which we're known for doing evidence-based policy, take us where the facts lead and putting it out. We're proud to put this out as if it's one of our senior researchers here. So I think you guys should be very proud of what you're doing and what you've done. I think the thing that we're grappling with here, looking at the opioid crisis, and maybe you can talk about it. You did talk to a lot of people. You had a lot of interviews, which was really interesting to read, which you'll see in the report. And there was lots of tension, even people participating in the program, right? On one hand, they said, this is great. And on the other hand, it's a totally frustrating experience. Maybe based on, I think the interviews themselves were interesting. Maybe you can explain, you changed the name, but Jamie or some of the people that you've talked to, some of those internal tensions, right? They're going through a struggle. They were arrested. They have a potential addiction problem. What were some of the things that they thought were great about the program that they're going through? And what are some of the frustrations that they're facing that you think are important to tell a policymaker when making decisions that you have to listen to people? And what are they saying?
This is from my interview with a peer engagement specialist, because he was also he's also a graduate from the Ulster County Drug Treatment Court. And one of the things that he said was that the drug courts really, they keep you on check with constant drug tests, and they make you attend, whether it be AA meetings or whatever the services you need or treatments you need. They really keep you on check with that. So for him, that was very helpful, and it was, he said it was a kind of like a slap on the wrist every now and then. But one of the things that he noticed that was very challenging as a participant is that there are not, once you graduate from the drug court, that's like only halfway there to recovery. Many graduates don't know what to do upon graduation. They struggle with getting housing. They struggle with finding jobs, because many people don't like to employ, whether it be like felons or any people who have been incarcerated. So there's a lot of, again, the stigma, and yeah, it really affects their lives upon graduation.
With respect to stigma, I wanted to add an interesting tidbit that I learned from an interview with someone who, he's a program coordinator for Project SafePoint, and if you're not familiar with that, they specialize in harm reduction in the capital region, as far as providing needle exchanges and safe ejection spaces and things like that. But one of the things he said that really stuck with me was that specifically people who inject drugs are stigmatized in a different way. There's sort of a hierarchy of drug users, if you can imagine that, and people who inject drugs are, for whatever reason, at the bottom of this hierarchy. So they're stigmatized even within their own community. Even people who use drugs in addition to them see them as sort of dirty or unclean in a way that other drug users are not. And so this adds another layer to the effect that stigma has as far as them being hesitant and coming forward and seeking treatment.
I wanted to add that as we interview these people, these programs that they have, like SafePoint and LED and Chapman Cares for You and Pathway to Recovery, they all matter. Even as small as like a helpline, they matter to these people who are struggling with substance abuse, because sometimes all they need is someone to talk to, and that's one of the things we talked about. Pathway to Recovery has a helpline, and sometimes in the helpline they don't get any calls, or they get one call and it's multiple calls with one person who has been struggling with substance abuse, and those little things actually grow into them actually seeking treatment. So having these programs and helping them get funded and helping people to see that they could get treatment, and just people changing their way they see substance abuse matters into helping them get clean and actually be better themselves.
Yes, one more question, and you guys are just raising all kinds of good issues. I wonder if I know you don't have the data, but I was just wondering in the interviews whether you came across anybody who had talked about any hints of discrimination or different ways of treating people of different races or ethnicities in the decisions or judgments about diversion. Who gets opportunity for diversion and who doesn't?
So I didn't see anything specific for the 3rd Judicial District, of course, but when I was analyzing, there are only 2 obvious long-term reports on drug courts, and that's from a court in Oregon and a court in Baltimore. And in Baltimore, they had a lot more people of color in their courts, and they experienced a lot of higher recidivism after. So I don't know if that was due to any mistreatment in the courts or failure to treat, rather. Yeah. Who wants to explain?
Like previously mentioned, like County Recovery Services, they're the drug court in Greene County, they will refer the patients to there, and they always, every year they always report an annual report of like the percentages of the different races and stuff like that. And what you mostly see is that the majority of people who are in TCRS are white Americans, but because also it also depends on the area where the drug treatment is in. So Greene County is like 86% are white Americans, while there's 20% who are Black or African American, and like 2 to 1% who are Hispanic or Asian or some other. So it mainly depends on the area that the drug treatment court is in.
Well, let's give them a big round of applause again.
Thank you.